This is a difficult conversation, one that's been hidden in the shadows for far too long. But if you're over 60, your health, your joy, and your vitality depend on us having it right now. What I'm about to share is deeply personal, but I urge you to stay with me because the final insight connects everything, and it will change the way you see yourself forever. Breaking silence. I want to start by acknowledging the room this conversation takes up. For so many of us, especially from a generation where these things were simply not discussed, the topic of self-pleasure is wrapped in layers of shame, guilt, or even just awkwardness. It's a topic that has been relegated to jokes or whispers, almost never treated with the seriousness and respect it deserves as a vital component of our health. I've sat in my office with countless men and women, people who have built families, run businesses, and lived rich, full lives, who still blush and stumble when trying to talk about their own bodies. They speak of a disconnect, a part of themselves they feel they've lost or are supposed to have left behind, as if desire and self-intimacy have an expiration date. This silence is a thief. It robs you of joy, of connection, and of profound health benefits that are rightfully yours. My purpose today is not to be provocative or crude. It is to bring this topic into the light, to approach it from a place of science, compassion, and wellness. This conversation is about your health. It's about your heart, your mind, your hormones, and your spirit. It's about understanding that your body is not just a vessel to carry you through life, it is the source of your experience of life itself. And pleasure, in its healthiest forms, is a nutrient for your nervous system, just as essential as the food you eat or the air you breathe. The belief that this part of you should just fade away after a certain age is one of the most damaging myths we've been told. It contributes to a quiet sense of loss, a feeling that a vibrant part of your own life force is gone. I'm here to tell you that it is not gone. It may be dormant, it may be quiet, but it is there, waiting for you to acknowledge it, to reclaim it, not out of shame, but as a powerful act of self-care and radical self-acceptance. Let's be honest, the world makes it very difficult to have this conversation. We are bombarded with images of youth-obsessed sexuality, which can make anyone over a certain age feel invisible or irrelevant. Or we're given the message that as we age, our bodies are only things to be managed, problems to be solved, like creaky joints or high blood pressure. But where is the conversation about joy? Where is the conversation about the part of you that is sensual, alive, and capable of profound pleasure entirely on your own terms? I had a patient, a wonderful woman in her late 70s whose husband had passed away several years prior. She confessed to me that she felt a deep loneliness that wasn't just about missing him, but about missing herself, a part of her that felt loving and loved. She felt completely cut off from her own body. The journey back for her didn't start with a new relationship. It started with her giving herself permission to explore her own body again, to rediscover her own capacity for pleasure. It was a reclaiming of her own life force. That is what we are truly talking about today, reclaiming you. Hormonal harmony. When you engage in self-pleasure to the point of orgasm, your body unleashes a powerful, healing cascade of neurochemicals and hormones. This isn't just a fleeting feeling, it is a profound biological event with lasting benefits. Let's start with endorphins. These are your body's natural painkillers, more powerful than morphine. When you are flooded with endorphins, the chronic aches and pains that so many of us live with can genuinely subside. This provides a window of relief, a moment of peace in the body that can be incredibly restorative. But endorphins are also powerful mood elevators. They create a sense of euphoria and well-being that can cut through the fog of anxiety or low-grade depression that can so often accompany the challenges of aging. It is a natural, potent antidepressant that you have access to at any moment. Next in this incredible chemical cocktail is dopamine. Dopamine is often called the motivation molecule. It's part of the brain's reward system. When you do something that your brain perceives as good for you, it releases dopamine, which makes you feel good and encourages you to do it again. In our daily lives, we are often running on stress hormones like cortisol, which keep us in a state of high alert and can lead to burnout, poor sleep, and a weakened immune system. Orgasm provides a powerful counter-program. The surge of dopamine reinforces pathways of pleasure and reward in your brain, helping to rebalance a nervous system that might be stuck in a state of chronic stress. It can make you feel more engaged, more focused, and more interested in life. It is literally a chemical reset for your motivation and your joy. Then comes oxytocin, often called the love hormone or bonding hormone. Oxytocin is released during orgasm, and it fosters feelings of calm, contentment, and connection. While it's known for its role in social bonding, when you experience it through self-pleasure, it fosters a profound sense of connection to yourself. It lowers defenses, reduces anxiety, and creates a feeling of peaceful well-being. This is incredibly important. In a world that can often feel isolating, especially if you've lost a partner or live alone, the ability to generate this feeling of calm and contentment on your own is a powerful tool for emotional resilience. It is a warm, internal embrace that soothes the nervous system and reminds you that you are safe and whole. Finally, after the peak, your body releases a hormone called prolactin. Prolactin is responsible for the feeling of deep satisfaction and relaxation that follows orgasm. It has a powerful effect on your sleep cycle. Many people find that they fall asleep more easily and experience deeper, more restful sleep after an orgasm. This is not a coincidence. The release of prolactin, combined with the calming effects of oxytocin and the muscle relaxation that occurs, creates the perfect biological conditions for restorative sleep. For the millions of older adults who struggle with insomnia or poor sleep quality, this is a game changer. It is your body's own natural, highly effective sleep aid, with no side effects. This entire hormonal symphony, endorphins for pain relief, dopamine for joy, oxytocin for calm, and prolactin for sleep, is one of the most potent wellness practices available to you, and it is entirely within your own control. Physical wellness. Beyond the incredible hormonal benefits, the physical act of masturbation is a vital practice for maintaining the health of your sexual organs as you age. This is where the use it or lose it principle is not just a saying, but a biological reality. For women, this is particularly crucial for pelvic and vaginal health. As estrogen levels decline after menopause, the tissues of the vagina can become thinner, drier, and less elastic, a condition known as vaginal atrophy. This can lead to discomfort, pain during intercourse, and an increased risk of urinary tract infections. Regular self-stimulation, with or without orgasm, is a powerful way to counteract this. The act increases blood flow to the entire pelvic region, nourishing the tissues with oxygen and helping to maintain their elasticity and natural lubrication. It is a form of physical therapy for your most delicate tissues. Furthermore, orgasm involves involuntary contractions of the pelvic floor muscles. In essence, it's a workout for these essential muscles. A strong pelvic floor is critical for supporting your bladder and bowels, and maintaining its tone can help prevent or improve issues with incontinence. Many women are told to do Kegel exercises, but an orgasm provides a series of these contractions naturally and pleasurably. It's a way of maintaining the integrity of the pelvic architecture that supports your core organs. By regularly encouraging blood flow and muscle tone in this way, you are actively participating in the long-term health and function of your pelvic region, helping to prevent discomfort and maintain continence and comfort for years to come. This isn't about vanity. It's about fundamental physical function and quality of life. For men, the conversation often turns to prostate health, and for good reason. The prostate is a gland that produces the fluid that carries sperm. While research is ongoing and not entirely conclusive, several large-scale studies have suggested a compelling correlation between a higher frequency of ejaculation and a lower risk of developing prostate cancer. One prominent Harvard study that followed men for nearly 2 decades found that those who ejaculated more frequently, 21 or more times a month, had a significantly lower risk of prostate cancer compared to those who ejaculated less often. The theory is that regular ejaculation may help to flush out potentially harmful substances or carcinogens from the prostate, reducing inflammation and preventing the buildup of old cells that could become cancerous. While this is not a guaranteed preventative, it is a significant and promising area of research that points to a powerful health benefit. Beyond the prostate, regular stimulation is crucial for maintaining erectile function. An erection is a cardiovascular event. It requires healthy, responsive blood vessels that can open up and allow blood to flow in. Regular erections, whether through partnered sex or masturbation, act as a form of exercise for these blood vessels and the smooth muscle tissue of the penis. This workout helps to keep the tissues oxygenated, flexible, and healthy, which can help to stave off the effects of fibrosis, the buildup of scar tissue, that can contribute to erectile dysfunction. Just like any other muscle or system in the body, the mechanisms of erection benefit from regular use. It helps to maintain the neural pathways and the physical responsiveness of the tissues, making it a powerful practice for preserving sexual function and health long into your later years. Reconnecting you. We have talked about the hormones. We have discussed the physical benefits for your body. But now, I want to talk about the most important piece of this entire conversation. This is the insight I promised you at the beginning. The most profound benefit of embracing self-pleasure as you age is not just what it does for your body, but what it does for your relationship with yourself. It is an act of reconnection. Life, especially as we get older, can create a sense of distance from our own bodies. We focus on its ailments, its limitations, its changes. We can begin to feel like a stranger in our own skin. Self-pleasure is a bridge back to yourself. It is a dedicated time, on your own terms, to listen to your body, to understand its language again, to rediscover what brings you joy, and to be present with your own physical being in a loving and attentive way. For so many people, sexuality has always been linked to a partner. But what happens when that partner is gone, through death, divorce, or illness? Does that entire part of you, the part that is sensual and desires touch and pleasure, simply have to be locked away? The answer is a resounding no. Reclaiming your own sexuality through self-intimacy is an act of profound self-sufficiency and self-love. It is a declaration that you are whole and complete on your own. It is a way to generate feelings of joy, love, and vitality from within, for yourself. This is not a sad substitute for a partner. It is a powerful, valid, and beautiful relationship in its own right. The relationship you have with your own body and your own life force. It's about honoring the fact that you are still a vibrant, sensual being, and that you have the right and the ability to experience that part of yourself for your entire life. This is the ultimate act of self-care. We talk about eating well, we talk about exercise, we talk about getting enough sleep. We need to place self-intimacy in that same category of essential wellness practices. It is a way of tending to your emotional and spiritual well-being just as much as your physical health. It's about looking in the mirror and knowing that the person looking back at you is worthy of pleasure, worthy of joy, and worthy of a deep, intimate connection, starting with themselves. It dissolves the shame that we have carried for so long and replaces it with acceptance and grace. It is you, telling yourself that you matter, that your pleasure matters, that you are alive, right now, in this moment, and that you are deserving of the full, rich spectrum of human experience. So please, let this conversation be a permission slip. A permission slip to let go of the old stories and the outdated taboos. Let it be an invitation to explore a part of your own health that has been neglected for far too long. This is not about being reckless or shameful. This is about being whole. It's about understanding that your vitality, your joy, and your connection to life itself are woven into the fabric of your physical being. By embracing this simple, private, and powerful act, you are not just taking care of your health. You are coming home to yourself.